Welcome to Psycho Way Out Clinic. I'm Dr. Shide Sunday. Today we'll be handling a topic, 5 ways to treat hypertension and stroke without taking a drug. Studies have shown that many people die prematurely because of high blood pressure. Many die prematurely because of stroke. Cases of incapacitation, disability because of stroke. Many people spend their money, some sell their resources, everything they have, just to take to treating high blood pressure and stroke. Some even seeking herbal medicine, herbal remedies, still suffering with high blood pressure and stroke. Today, we are going to look at 5 ways you can treat stroke, you can treat hypertension without spending a dime in buying drugs or taking any medication. But before I handle these topics, I want you to click on the subscription button so that you can have our videos anytime we drop. Once again, let me briefly tell us what high blood pressure is all about and what stroke is before we look into 5 remedies that can help you overcome this sickness without taking a drug. High blood pressure, as the word implies, has to do with a medical condition whereby the force of the blood against the artery wall is too high. As the word implies, there is too much pressure, there is a high pressure of blood flow in the or on or against the artery wall, which can cause heart failure, can destroy the heart, can cause stroke, can cause many physiological damages to human body. Now, on the other hand, stroke has to do with the obstruction, resistance, or abnormality of free flow of blood into the brain, which can be as a result of any physiological anatomical disability that we are going to talk about. This limitation, these abnormalities lead to resisting or making the brain cells not to have the nutrients they need for survival, or limiting the brain cells from having the oxygen they need to carry out their function, thereby leading to either disability in terms of paralysis, in terms of the ineffectiveness of the brain to communicate other parts of the body and carry out the body function. There are 2 types of stroke: ischemic stroke and hemorrhagic stroke. Ischemic stroke is the type of stroke that is caused as a result of blockage in the brain. When there are blockage, preventing the blood to flow from one part of the brain to another. That can be as a result of tumor, can be as a result of infection, can be as a result of disease, can be as a result of the rate at which the heart pumps blood. And then the second type of stroke is hemorrhagic stroke. Hemorrhagic stroke is the type of stroke that has to do with bleeding, circulation of blood or secretion of blood in some parts of brain that are not, they are not needed. Movement of blood into some tissues, some part of the brain that are not supposed to be. So they are mostly caused as a result of either excessive bleeding or burst, or when the tissue tore, or the tissue is having an issue that permits the blood to move in such a way that it causes damage to the brain. It will interest you to know that both hypertension and stroke are determined by the function of blood in the body. And it will also further interest you to know that the function of the blood in the human body is determined by the function or the structure of the heart. Therefore, these 5 points are hinged on getting the heart to function well without taking drugs, without taking any medication, getting the heart to function well. Because when the heart functions well, the blood will function normal. And when the blood function normal, the blood pressure will be normal, and the stroke to an extent will not have effect on individual. Thereby you get your healing free of charge. Point number 1 is positive reflection. Now, it will interest you to know that everybody have a past good memory, past exciting moment. Now, a patient of stroke or hypertension should on a daily basis find between 20 to 30 minutes a quiet moment to reflect on past memory. Just find a quiet environment, reflect on past memory, maybe past memory of exciting moment of your life, maybe when you were employed, moment of when you got an admission, moment of when you received some gift, moment of maybe your childhood experience. Just find a quiet moment and reflect on past memory. Identify those moments in your life that are very, very exciting. And use 30 minutes on every day. Reflect on them. By doing that, you are triggering the secretion of certain hormonal reactions to your body. Because, of course, some of the causes of stroke and hypertension are hormonal reactions or neurological causes. So by having reflection, positive reflection on past memory, you are stabilizing hormonal activities in your system, thereby giving way to negative hormones or hormones that trigger high heart rate, and then reducing the state at which your heart functions, making it to be stable to pump the blood needed for your brain to function, for your body to function, without making it excess or making it below the expectation. The second point is negativistic avoidance. You have to intentionally avoid bad moments. You have to avoid sad moments. You have to avoid people that whenever you come in contact with them, you will be angry. They will make you to be angry. They will make you to be sad. You have to avoid going to places that when you get to those areas, they cause your memory to reflect on negative events that will change your heart rate. You have to now avoid doing activities. If watching football is what you love most, but if your team loses any match, it takes you 1 or 2 days to recover from that shock. You have to avoid watching football so that you don't watch a match that they win your team and it causes sadness in you. By doing that, you are doing what I call negativistic avoidance. You will get your heart stable. You will not get your heart being disturbed by emotional instability that will cause the heart to function abnormally, which is the source of interrupting with blood circulation in your system. The third point is self-motivation. In most cases, you don't need to wait for anybody to motivate you. Identify things that push you, things that get you doing things at ease. Identify factors that give you joy and set them as motivating factors to yourself. Get your pen, write down things that whenever they are in place, you can go to any length to achieve things. Is it a food that anytime you have this kind of food, you like it and you can do anything to have it? Is it an event? Is it a recreational activity that anytime you find yourself there, it gives you joy? Set all the motivating factors, both intrinsic and extrinsic motivating factors, to yourself, and always put them in place so that whenever you achieve your goal, you put those motivational factors in place, and it will be yourself motivating yourself. And by doing that, you discover that your heart will be getting what it needed or what is needed for it to function well, optimally, without disrupting or disruption to blood circulation. The fourth and second to the last point is exercise. Now, find good moment of your life, maybe early in the morning or in the evening before you sleep, and do exercise at least 5 to 10 minutes in a day. Because your heart is a tissue, is your body organ, and it needs some physiological balancing in your system to function well. Now, by carrying out some daily exercise, not excessive exercise that will lead you into too much stress, just simple exercise that will get your body okay, the anatomy, the physiology, the activities of your body will begin to be normal, all your veins will be flowing well, and by doing that, your heart will get the strength, the backup, what it takes to function optimally without any disruption. The last point is relaxation and rest. If you are a patient of hypertension or stroke, you take at least some hours a day. Apart from you sleeping between 6 to 9 hours every day, you take at least not less than 30 minutes to an hour to relax. Just rest. Even if you are not sleeping, just lie down on a bed or any place that is quiet. Lie down, rest, have positive reflection. Begin to think of things that excite you. Relax your veins, relax your nerves, relax yourself, and just feel free. By doing that, you are strengthening your heart, you are strengthening your body tissues, and you are making your body to begin to function in such a way the blood circulation will be in an expected rate, and at the end, it will lead to total healing of you from stroke, total healing of you from high blood pressure. You will no longer have the high blood pressure, and the brain will now be having the normal blood expected for the cells to function normal. At this point, I want to thank my viewers. Once again, if you are yet to subscribe, please don't forget to click on the subscription button so that you'll be notified of all videos when we drop on this YouTube channel. Also, share this video with your loved ones. Share this video on your social media platform so that many people can have access to it. Until we meet again, I am Dr. Shide Sunday. Thank you.